If back pain is harming your quality of life, the Arizona Brain and Spine Center is here to help. Here with treatment options is Dr. Igor Yusupov. Thank you so much for joining us.
Pleasure to be here.
Now, what are some of the most common spinal conditions that people suffer from?
A lot of my patients come in with neck pain, back pain, radiating symptoms to the arm or leg, and there could be other symptoms like spinal stenosis related, difficulties with walking, difficulties with performing daily activities.
Now, what are the causes of these symptoms and problems?
Most of this stems from degenerative changes in the lumbar or cervical spine, which comes from wear and tear.
Okay.
In the lumbar spine, for example, disc degeneration leads to pain, instability, compression on the nerves, disc herniation, which may lead to arm or leg pain.
And for a lot of people, obviously, it's really debilitating pain. Are there some, non-surgical treatment options available for people?
Absolutely, and we're trying to maximize the conservative measures first rather than proceeding to surgery. Conservative measures consist of physical therapy, sometimes injections if necessary, which will alleviate the pain and allow the patient's body to recover and fix itself. If the conservative measures fail, then we can assess for surgical interventions.
Okay, so that is, if that doesn't work, you try that first, and if not, then surgical options are available.
Absolutely.
Okay, and then what are the advantages of minimally invasive surgery for people out there?
Minimally invasive techniques came on about 10-15 years ago, and the idea is to preserve as much of patient's anatomy as possible and to do as little damage as possible, but still achieve the goal of repairing whatever it is that's causing the pain and disability. So for the patient's benefit, the incisions are smaller, the tissue trauma is minimized, blood loss and anesthesia time is minimized, and all of those were lead to increase activity level early on, so their rehabilitation is earlier than with standard practices in the past. The minimizing the tissue trauma also leads to faster recovery, less blood loss, which leads to less complications during the recovery time.
Okay, so if they do need some, surgery and need that option, then they don't need during doing this process, they don't need to be out and about, down. They're not going to have all that downtime.
Absolutely. There's absolutely no bed rest with any of my minimally invasive
Oh,
procedures.
wow.
We don't necessarily require people to wear braces to restrict their activity. We want them to get back to normal activity as soon as possible. And that's the advantages, because the tissue trauma is minimized. Their pain is less, they're hurting less, so they're able to do more and they're able to engage in physical therapy more vigorously and get back to normal conditions.
So there is hope out there. There's no reason why someone should be, have to stay in their chair or in their bed and not be able to get out and about.
Absolutely, and the goal is to provide quality of life and provide functionality. With minimally invasive surgery, that goal is achieved more commonly and faster.
All right, doctor, thank you so much, because this really affects millions of people, and they're just thinking, well, there's nothing that I can do, but there is, and you're able to help your patients.
Absolutely.
Thank you so much. We appreciate you being here. And of course, for more information about the Arizona Brain and Spine Center, visit their website, azbsc.com, or call the number you see right there on your screen.